back and forth, but I want to hear from you. So if I could ask you to refrain from your applause, I would appreciate it so that I have more time to hear from all of you. Thank you. My Republican colleagues have made killing healthcare reform the center of their political agenda. Their reform proposals focus on doing nothing. Nothing to control costs, nothing to expand access, and nothing to improve quality. The same people who spent $1 trillion in Iraq after misleading our nation into that war now say it's too expensive to invest in the health of Americans here at home. The same people who wanted to privatize Social Security are now labeling government-sponsored care, Medicare, and our veterans' health care, quote, socialized medicine. The same people who attacked President Obama's goals for health reform are standing shoulder to shoulder with those in the insurance industry that would dump sick policyholders and continue to collect billions in profits. I believe the time has come to put people before profits. The time has come to make preventive care a priority. The time has come to make social responsibility and individual responsibility the cornerstones for an expanded healthcare system. My principles for moving forward on healthcare reform in Congress must include the following. Every child in America deserves to have access to healthcare when they need it. If you love your doctor, and right now I'm loving mine a lot, just had surgery Friday, and you like your insurance, your current insurance, nothing needs to change for you. Keep what you have. But there must be a patient-centered approach to healthcare in which quality care improves outcomes, and there's a greater focus on prevention and healthy behaviors. I support a public insurance option that will increase competition in the marketplace, keeps premium costs down, and provides for affordable insurance for all Americans. These are the principles I will be working to advance in Congress, and I believe that they reflect the beliefs of the citizens I represent. In addition to the views of those of you here in the audience, I was presented today with a petition signed by more than 4,000 of our 4th District friends and neighbors, and that's what's here on the stool. These 4th District residents support President Obama's goals of reforming healthcare. The chair before me, as I said, has 4,000 plus names. They all couldn't fit in the chapel tonight, so I'm glad that they contacted our office. But we also hear from people as the constituents whose stories are shared with you later on a daily basis. Let me wrap up by saying this. I believe we need to prohibit discrimination by insurance companies based on pre-existing conditions. We need to end the annual or lifetime caps on payment that deny coverage. It's time for policyholders to get the coverage that they paid for. We need to strengthen Medicare by eliminating waste, fraud, and abuse that siphons off valuable health care dollars away from our seniors and puts it into the pocket of crooks. I support eliminating the Medicare Part D donut hole and to make prescriptions more affordable for our seniors. For mandating that Medicare negotiate with the drug companies to get the best price for taxpayers. And regarding cost, we need to pay for reforms and efficiencies and expand preventative care that saves money and cut excessive profits out of the system. Minnesota, as was pointed out by the President, has been unfairly treated by Medicare, with our doctors and physicians being paid less than what half the providers in Florida receive. The entire Minnesota delegation, Democrat, Republican, Senate, and House, are all working to fix these geographic payments, and I'm proud to have the leadership role in doing that. I'm going to keep fighting to make sure that that happens for our doctors here. And finally, I support health professionals and clergy working together to provide patients and families information and counseling, options that enhance human dignity and respect one's faith at the end of one's life, as I was so grateful to have that guidance in the last days of my mother's life. And now I want to hear from you. The format that we're going to use tonight is similar to the one we used at the Health Care Forum last month. Every speaker will be given 2 minutes to share a comment or an option. You know where I stand on the issues. Now I want to hear from you. Andrew is here as our timekeeper. Andrew is coming forward. And he will randomly draw tickets to select speakers. If your number is drawn, please move to the aisle. And my staff will bring a microphone and they'll hold it for you. Out of respect for all gathered, I would ask the audience to refrain from jeering and catcalls or other loud outbursts. We are here in a chapel, and I would expect our combined conduct to reflect both the dignity of the venue and the seriousness of the issue that we'll be discussing. Again, my sincere appreciation of McAllister College for hosting our event. And I sincerely want to thank all the active citizens that are here today with me and those who contact our office. I'm eager to hear your thoughts, and Andrew, I'll let you begin.
Okay, 259, 224, right here. All right. 224 and 300. Okay, my name is Nick. I'm 31 years old, wife of 34. I have 2 children. One's 1-year-old, one's 2 years old. And I agree, there are problems in our healthcare system right now. My firstborn ended up in Children's Hospital when she was 1 month old, and they told her she was going to die. Luckily, I had health insurance, good health insurance through my wife's employer, and they paid the bill, and today she's still here. And what I fear is that under a government-run policy, she would not be here because the general consensus among all the physicians was, her life's not worth saving. But, you know what, since your insurance policy will keep her in the ICU, we'll keep her in the ICU. And that scares the heck out of me. There are other options besides the options they're putting on the table. If the biggest concern of most people is losing their health insurance. Why? Because it's tied to your job. We need to take health insurance and de-tie it from your job. We need to take the tax code, change it so individuals can have the deduction that businesses currently have. Do that, and companies will be forced to sell insurance to the individual. No more big businesses lobbying to get better prices, competition will flourish, and healthcare will come down in price. Second, healthcare needs to be sold like life insurance, long term. You need to buy 10-year policies. Pre-existing conditions will not be affected. You buy into a long-term policy, you can't get out as long as you keep paying your bills. Okay? People who can't afford them, there can be tax law changes made so that people that truly cannot afford health insurance can get the tax breaks and the credits necessary to pay for health insurance. Beyond that, I guess I'll rest my case at that point right there.
Thank you. Those were very, very good ideas. Thank you.
Good evening, Congresswoman. My name is Mary. I'm a healthcare provider. I've worked in the clinic, in the emergency room, and I very much appreciate your willingness to state that healthcare is a right.